The measuring of nutritional status in patients with inborn errors of metabolism, and particularly phenylketonuria, is very, very important. In fact, inborn errors of metabolism are caused by defects of enzymes or transporters that affect metabolic pathways. Usually, specifically when we are talking about inborn errors of protein metabolism, and particularly phenylketonuria, what we will need is a very specific nutritional treatment that usually is a combination of natural protein restriction and supplementation of special low protein foods, and most importantly protein substitutes. Majority of these products are amino acid mixtures. In that way, we need to find the correct balance of the nutritional intake of these patients. It is very important, first of all, to check all the anthropometry and body composition markers. In addition, the biochemical, the biochemist pathways, and particularly the biochemical markers of nutritional status should be also measured. And obviously, don't forget any clinical signs of nutritional deficiency, apart from the nutritional intake, the dietary recalls that we need to check in every single patient. With all this information, we can have a general overview about the nutritional status of these individuals in order to make the adjustments. These adjustments should be made during lifelong treatment according to this nutritional status measurement. Nowadays, with improved nutritional care, with improved treatment approaches in inborn errors of metabolism, we are not merely focused on preventing neurological outcomes, but we are always focused in optimizing long-term outcome, optimizing health markers, optimizing everything as we should look in a normal individual. The impact of amino acid mixtures in patients with inborn errors of metabolism is huge. I selected the word huge because the protein substitutes, the amino acid mixtures, are synthetic products. By one hand, we need these synthetic products because in some of the diseases, these products are life-saving. These products are the guarantee for optimal long-term outcome. Nevertheless, on the other hand, we should not forget that these products are made according to the metabolic defect of each disease, each individual. So we need to understand that, first of all, the nutritional composition of each individual protein substitute is critical, not only regarding the quantity, the quality, or the proportion of amino acids, but also about the micronutrient intake and balance of these products. But at the end, forgetting a little bit the metabolic pathway in itself, we will need to check the correct balance of micronutrient intake. So the micronutrient intake is also critical because the patients, and linking this with the whole nutritional status, the patients can have a good nitrogen and a good protein intake as a whole, but if the micronutrient intake is not guaranteed, if the micronutrient status is not achieved in these individuals, the growth, body composition, neurological development, and long-term outcome will be also affected. So we don't want to have any bad long-term outcome by the disease itself, neither by the treatment. So we need to concentrate on how to balance the nutritional approach in the treatment as a whole in order to optimize long-term outcome in these individuals. Nowadays, it is even more important to check the nutritional status and health outcome in adulthood, because patients with inborn errors of protein metabolism usually live longer than before, because they are treated in the early stage, in the neonatal period, so we must be in a good condition to achieve a good health status in adulthood. By that way, it's important to prevent comorbidities like overweight, obesity, hypertension, kidney dysfunction, and cardiovascular disease. By that way, more or less, and nowadays, is very important to understand that the kinetics of absorption of amino acids are not exactly the same as natural protein. By that way, all the approaches that we can use in our clinical practice, for instance, dividing the dose of amino acid mixtures in several meals per day in order to reduce the amount of amino acids that are absorbed at once, are very important in order to achieve the right balance between calories, protein, the other macronutrients, and the global picture with the micronutrients, fiber, water, etc. Only in that, with that approach, we can guarantee that we are giving to our patients the best nutrition, the best personalized treatment in order to optimize their outcome.